pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Item 3, public comment. Do we have public comment? No public comment. Number 4, approval of the November 7th, 2023 Public Safety Committee minutes. A motion. We have a second? Second. Motion made second. All in favor? Aye. Any opposed? Motion carried. Thank you. The motion is by Mark. 5, policy issues, discussion, and potential committee determination. Update and potential action regarding continuing joint powers agreement for E911 NG-911 system. With that, I'll turn it over to Administrator Leonard.
Thank you, Mr. Chair. In your packet, the first page of attachments is the longstanding joint powers agreement Marathon County has relative to 911 services with the City of Wausau. Marathon County took over comprehensive dispatch services a number of years ago. And that document is to be executed every year. You'll see it was last signed in March of this year. It does terminate at the end of 2023, but I believe all parties are in agreement with continuing that longstanding partnership. If there are any questions, or I should say the longstanding agreement, if there are any questions, I'd certainly turn it over to Chief Deputy Milhausen to talk a little bit more about our 911 services and E911, but just looking for direction from this committee to, again, execute that agreement.
Any questions?
A motion approving the continued agreement would be appropriate. Thank you.
Second.
Motion made
to
second.
continue the agreement.
Any further discussion? All those in favor? Aye. Any opposed? Motion carried. Thank you. That will move on to 5B, consideration of the opioid settlement fund deployment recommendations from the Criminal Justice Coordinating Council. And I will again turn it over to Administrator Leonard and Judge O'Neill. You'll have something to say, Lance, I'm fairly certain.
Yeah, of course, we'll have something to say, but good afternoon, everybody. Thanks for inviting me. So as you know, the County Board had asked the Criminal Justice Coordinating Council to review and consider how to best allocate funding that was anticipated to be received through the settlement of the opioid lawsuit. And so the CJCC did partner then with Marathon County Health Department to help facilitate the discussion so that we tried to stay on task to identify evidence-based programming and services to best effectuate change and recovery in our community. So in March of 2023, the CJCC did collaborate with the health department to discuss the use or the recommendation as to how to use that settlement funding. We engaged in a results-based accountability framework. That was a framework that was set up and organized by the health department to help our committee really be as efficient as we could with our time and to try and come up with the most productive conversation and recommendation for the board. While using this framework, we did define our result and our hope, and our result that we did define was that Marathon County residents would be free from the physical, emotional, social, and economic impacts of opioid misuse. In discussing then how to effectuate that result, we met for 6 times over the course of those 6 months. We met once a month for about an hour and a half, 2 hours to engage in that discussion. We considered several at-risk groups in our community, including the drug-endangered children and addicted parents in our community. We considered at-risk teens, the incarcerated population, those with dual diagnoses. So we tried to consider a number of groups in our community that are suffering from opioid addiction. We also consider the existing services that we have in the community, how they're impacting and helping our residents to fulfill that result that we had defined. We also consider them potential services and programmings that we could implement if we had the funding to help serve those at-risk and in-need populations. After several discussions and several hours together, we ultimately, having defined a number of ideas, realized that the best use of the funding at this time would be to retain a consultant to conduct a gap analysis to identify where the county is failing to provide resources to the community, which in turn is aggravating the opioid epidemic. Bottom line is we were able to identify a number of services and resources in our county that we are using that are trying to help that at-risk population. And then there were services that we're not funding. And we were having a difficult time figuring out really those gaps. Like where are we missing the most people? What population is really not being served by the number of programs that we do have in the community? Because we really do. We are a pretty progressive, proactive community with regard to drug addiction. We have a lot of services through law enforcement, as well as through the health department in our efforts to try to assist this at-risk community. But we know that we're missing a lot of people, obviously, from the evidence. And so to best figure out what group of people we're really missing, we thought that the first step really should be to do a gap analysis. So our recommendation ultimately was that we initially use some funding, not all of it, but some funding to try to do that gap analysis to identify which individuals in our community are being missed and which we can help with the funds. So with that, I'll turn over to Administrator Leonard.
Sure. And everyone, within your packet, there's a report, and that really is the culmination of that work that Judge O'Neill referenced. So I'll just kind of elaborate on a couple of points about the process. And I want to make one thing very clear, and Judge O'Neill alluded to this. The funds that we received or we are due to receive through the settlement, and one of the first pages of the report, and I'm going to be showing it on your screen right now, does talk about the distributor settlement dollars that were projected, that the county is projected to receive over the next approximately 15 years as a result of that opioid settlement. Those dollars, the allocation of those dollars, that is 100% an issue for the county board. The work of the CJCC, as Judge O'Neill referenced, and Judge O'Neill chairs that group, was to come up with some recommendations for the board's consideration. And because this committee, the Public Safety Committee, of course, is intimately aware of the challenges that are faced, particularly within the justice system with these populations, we're presenting this information to you. It also was presented earlier this week, or last week, to the Health and Human Services Committee, and I want to talk a little bit about that presentation. We're going to go through the same information today, but ultimately at the end of the day, they didn't make a recommendation relative to the merits of the recommendations within this document. They wanted to wait to have this committee review the information, and ultimately they suggested holding a joint meeting. And in fact, in working with Chair Van Cray after last week's meeting of the Health and Human Services Committee, your next Public Safety Committee meeting in January could serve as that joint meeting. Have this committee meet at approximately 1:30, as you always do, conclude your business, and then move into a joint meeting was the suggestion of Chair Van Cray. So we'll see if that transpires, but that at least was the initial conversation there, really to allow for that multidisciplinary conversation. So again, here's the settlement projection, and this again is the distributor settlement. Multiple distributors settled the pending lawsuits of which Marathon County had joined, and you can see it's a pretty considerable amount of money over those next 15 years. There are other forms of opioid litigation that are ongoing and that the county has been a part of, but this relates to those funds. And I want to start by saying, and I'll show this later in the presentation, and it's actually in your packet as well. It's not surprising that as part of our work, we really started with what are the requirements of that settlement. This was a court settlement, so as you might imagine, the dollars that were allocated or subject to that settlement are not able to be used on absolutely anything. There are some guidelines and requirements relative to those, and that's in one of the exhibits to the document. So the process that Judge O'Neill referenced, that results-based accountability process, was led through the CJCC with the help of the health department, which I can just say was very helpful. You can see the CJCC makeup here on your screen. It's a very large group, a lot of law enforcement representative, courts representatives, but also there are county board members that have participated in that. Chair Boots is on that group, as well as Chair Van Cray, and in fact, Board Chair Gibbs is the vice chair of the CJCC. So that discussion process, going through the timeline that Judge O'Neill referenced, it really did begin with kind of trying to articulate what the goal, what that end result was, and Judge O'Neill read that to you, that Marathon County residents are free from physical, emotional, social, and economic impacts of opioid misuse. We then tried to identify what indicators would be helpful to help us understand if our efforts that we would undertake pursuant to allocating those settlement dollars, that the board would allocate those settlement dollars, how do we know if we're making a difference? And the data measures that the group ultimately thought would be helpful in that endeavor, both related to opioid overdoses. So the first is the number of suspected opioid overdoses, and that's information that we would get from, it's an ongoing measure. It exists from our EMS services through the Department of Health Services. Those are individuals that do not perish. They overdose, but through the work of EMS, perhaps law enforcement, they are taken for emergency medical assistance, and we have that data. The second is drug overdose deaths, and that's information that Jess and her team ultimately provide relative to Marathon County. Each of these, again, we thought would be helpful. It's not a perfect measure to know if we're being successful, but certainly in the group's estimation, those were the two indicators that we thought were most important. Then it really did go to that work of identifying what are the allowable uses of those funds in that exhibit that I referenced. What can we use the money for, and what do we think would make a difference? So the group sat in this room over those many months, and at some point we had the wall covered in sheets of sticky paper, and we all were allocated little dots to go through and explain rather where we thought our best return on investment or best impact would come from the utilization of those dollars. And that really comes to the strategies that were recommended. And Judge O'Neill referenced the first strategy, and I'll preface this with something I said at Health and Human Services. All of the items on this high, medium, and low rank order document in your packet, the group, they're all good ideas. So the fact that something might rank low or medium doesn't mean it's not without merit. It's just through that process of the group getting together, talking about how we best thought it was appropriate to allocate those dollars. The high, medium, and low corresponds to where all those sticky dots were allocated following our conversations. So the first one you'll see is that gap assessment relative to the continuum of care for treatment and recovery in Marathon County. But it's important to note we also had a number of other recommendations as part of that process in looking at those allowable uses. The second is to expand the Marathon County Sheriff's Office deflection program, which is now housed within the DA's office, and the Wausau Police Department's Police Assisted Addiction Recovery Initiative, or PARI initiative, to route low-level drug offenders to treatment instead of through the justice system. The reason you'll see the asterisks there is because we do have current grant funding that provides for the execution of each of those programs, at least for some foreseeable time. Next, you'll see the medium area, expand medication-assisted treatment, or MAT, in the county jail. Again, that's an area where the Sheriff's Office has worked to secure funding. 4 is provides stable and sober housing in Marathon County. 5, expand the number of MAT providers in Marathon County by providing fellowships for addiction counselors, offering scholarships and support for workers in MAT, and providing funding and training for clinicians to obtain waiver under the Federal Drug Addiction Treatment Act. 6, I know this group has heard of the CART model, but it's very similar to expand a co-responder model like CART or the chaplain program that pairs law enforcement with a therapist to address opioid use disorder and substance use disorder related calls. 7 is support early intervention programs for at-risk students in Marathon County school districts. 8, support and expand peer recovery coaching in the county. And number 9 is explore a countywide naloxone plus strategy, work to ensure that individuals who have received naloxone to reverse the effects of an overdose are then linked to treatment or other appropriate services. So that, again, is the result of that kind of ranking exercise that we went through. But you'll see there, again, all those are good ideas. Ultimately, again, the CJCC brought forward this report for your consideration, the board's consideration in determining how best to allocate those dollars that you've received to this point and that that the county is due to receive over the next 15 years. So as I alluded to, we did have that presentation with Health and Human Services, and their request was to ultimately sit down with this group and have a joint meeting. But I know it's a lot of information to digest. We provided some of this, I think, at your last meeting. But if you have any questions, we have a number of CJCC participants in the room. Happy to answer any questions you guys may have.
Supervisor Marash.
First of all, thank you for all the hard work everyone's put into this. We appreciate it. Just going over everything, I came up with a couple questions. Page 12, we were just on that, where it says the Marathon County Sheriff's Department submitted a modification to the deflection grant seeking $384,740 for the program period of 4/1/22 to 9/30/24, and that the modification is currently under review. I was wondering if we could get a little more information on that.
Thank you. Yes, the reason it was under review is the modification was in some transition between North Central and the DA's office with where that was going to reside. The grant has to have a law enforcement agency be the applicant, so that's why the sheriff's office was involved. And ultimately, if I recall, the grant was modified after the district attorney's office took it over so that we could have those funds extended out. And then if it's my understanding, there's going to be a review. Maybe Ruth could talk more to it, but there's going to be a review after the beginning of the year is what I last was told. Maybe you could talk more.
Yeah. So the modification was because the state had additional funds available this year. So all the different sites that already had a grant with the state for deflection were offered an additional lump sum of money. So we applied for it and got it, and most of it is supporting payment of treatment at the moment. So we increased treatment funds so that we can pay for people going into inpatient, pay for some of the out-of-pocket costs for that, and for out-of-pocket costs for any kind of other treatment. So that's basically what the one-time thing is. And then at the end, that additional funding is not guaranteed going forward. So the one position will be paid for, but the additional, I think it was whatever it says on there, the additional funding is not guaranteed to continue after this year.
Thank you. I was just curious what the holdup would be because it sounds like it would be good and should get it moving forward as quickly as we can. Additionally, I have to put my glasses back on. Sorry. Let's see. Page 13, Strategy 4, provide stable sober housing in Marathon County, saying support current sober housing facilities. What exactly do you mean by support, and how will you determine the funding needs?
Well, I think that's a question ultimately that the county board would have to determine what needs it wants to support. The county board through its annual budget process already provides direct funding to North Central Healthcare for purposes of the Hope House, which is that sober housing resource available in the city of Wausau. Off the top of my head, I want to say that it's about $40,000 annually that the county allocates, but don't hold me exactly to that number. I can get that for you. But the idea that, there is, the group had those discussions about really what is the supply of housing that is needed for individuals that are struggling, with substance use disorder or opioid use disorder. As we've talked about with this group before, one of the programs that we offer in the justice system through the court system is our drug court program, or our treatment court program, and we do have housing resources specifically available for individuals going through that process. But the idea that more housing resources might be useful was, again, the recommendation from the group. We didn't get into the detail about what truly is the need in that area. I think that's certainly something in that gap analysis that Judge O'Neill referenced that we can specifically ask, what is kind of the supply that would be needed. I don't know if you have anything to add, Judge O'Neill.
Yeah, I would just note that certainly through my participation in the drug recovery program, it's clear that when people initially are starting to commit to sobriety, more often than not, they're not employed, right? And they don't have a residence. They're pretty much couch surfing. They're finding one friend to another, and usually they're drug dealing friends. And if they're really going to commit to sobriety, they need an entirely new sober network of connections. And they got to get out of those homes where they've been provided those drugs, and they have to get into a sober living environment. And that's really been a key to the success of the participants in the recovery program. And so just kind of units. So that's just, but it was a very general conversation, and yeah, we can't give you numbers or how many people it would impact.
Right, I completely in agreement with you on that, and I was just curious with some of the listings of facilities such as Gospel TLC, if it was maybe discussed, because unfortunately I wasn't able to make those meetings, if there were going to be donations made for different nonprofits, or what, I didn't know what you guys had discussed and what you were thinking, so thank you.
Yeah, we really didn't get into the details. I think just to build on what Judge O'Neill said, I think it's important when we talk about that gap analysis for the continuum of care. If you think about individuals like Judge O'Neill said that are coming into drug court and some of the challenges, or treatment courts, and some of the challenges that they might have, the same is true for individuals if they get into Lakeside Recovery now that is going to be doing its soft open. The idea that you go through a 28-day treatment, where do you go when you have gone through that? And if the answer is you're going back to kind of the same place you were before, that's a real challenge. So making sure that whether it's, certainly I don't think our group got into the idea that it needs to be led by the county. You referenced, nonprofit organizations like Gospel TLC. For Judge O'Neill and I went to that open house, and, for a number of people, that's going to be a very important resource. It's just, do we have enough resources through the various entities that are available?
And that the housing thing has been discussed at length at the state level and the national level for NACO and WCA, and that's something the county board is going to have to either get on board with or not get on board with. And we've had several discussions, obviously, in the last couple of years, even on housing things. So yeah, I agree with that. We'll probably have to tackle that a little more on the county board level, but yeah, that's a down the road conversation I think that we definitely need to have. I know Sheriff Billup also has talked about housing issues in the past. So, Supervisor Wilhelm.
Now, with you're dealing with people like in drug court that get arrested now. When you have people that get arrested for drug charges that are using that end up serving time in jail, what is the chances of them going back into the same setup where they're still using drugs when they get out? Because, I mean, people go into jail and I'm assuming that they're clean for maybe a year or 2 years, whatever they serve, or 6 months. Now, what are the chances of them actually staying clean after they get once they get away from the drugs and they're out, or is it just something that is tough to overcome.
So, and I don't have actual data. I don't know if Laura maybe does, but anecdotally, from what I've witnessed myself, more often than not, people just go back to their community, right? And they go back to what they know. So if they've been in prison, they've been in our jail, they go home because that's what they know. And it's very hard, right, to survive in life alone. And until you're in a position where you can start building a new community, where you can get involved in maybe the AA community, the NA community, you're just they just tend to go back to their old friends, their old connections. You know, one thing I think we've noticed through the drug recovery court is them canceling their Facebook account is like a key indicator of success. Because even if they stay on Facebook and they're like, that's okay, I'm going to be sober, right? Just that Facebook connection. They see one post from one friend and they're lonely on that day and they respond, they're at risk. So one of the toughest challenges for them when they get out of custody, they are sober, they've had a period of sobriety, is where do I go? Even the most motivated person who wants to stay sober a lot of times does not have a place to go. And that's why, you know, sober living is kind of something that we really looked at and are struggling with, because of course we want to be able to provide that transitional living situation to everybody, but obviously that's kind of impossible. But where can we impact, and you know, really where's the biggest bang for our buck in this settlement? So I mean, to your point, it's a great point, because that first step out can be success or it can be failure, and it's so often failure because they've got nowhere else to go except to the life that they once knew.
I think it's important to note, and Ruth is in the back. I mean, you know, our continuum that we talked about is not only the people that, and this isn't perhaps an appropriate phraseology, but the deep end people that are in drug recovery court or on the looking at potentially going to prison. But we through our law enforcement officers and the justice system interface with a lot of people that are more, again, for lack of a better term, on the lower end, but they still have significant needs relative to substance use disorder, opioid use disorder, and those challenges are sometimes the same, like Judge O'Neill referenced. You know, just because someone is not looking at potential drug court involvement doesn't mean they don't have the issues relative to safe and sober housing and linking them to treatment, which is, again, one of the hallmarks of what we hope our deflection program is going to do, right? It's going to catch people at that very initial stage of law enforcement interaction and divert them out of the criminal justice system and have them work with the DA's office to link them with treatment available in the community, and then also address all of those other constellation of issues. Because, you know, if you just deal with the treatment, as Supervisor Marash's question kind of led to, it doesn't do a lot. You put a lot of resources in, and then you expect success if you put them back in that same environment. It doesn't work. The same is true with deflection. You know, if we're linking people to treatment through that initial process, we still need to make sure we have, whether it's a nonprofit network or dedicated resources to help those people be successful.
Yeah, so to add on to that, Supervisor Wilhelm, I mean, like a lot of the stuff at the WCA and NACO, again, you know, we have a lot of, the majority of our alternative programs are trying to get people that habitually use the criminal justice system. So it's always been that habitual users, like how can we have the same person coming through all the time? So yeah, I mean, there are actually, we've talked about it at length too on some of those other things, but yeah, those are metrics that I think they're diving into here a little bit more.
Thank you.
Any other questions? With that, I guess I would ask if there was no objection that we would schedule that meeting in January with Health and Human Services, if there's not an objection. So we don't need a motion or anything. We'll just do that then. So.
And if there's information that is not in the report that you would like in advance of that joint meeting, please don't hesitate to reach out.
Thank you, Judge O'Neill. All right, that will move to 6A, operation functions required by statute, ordinance, resolution, or policy, authorizing the sheriff office participation in the Department of Natural Resources Boat Enforcement Patrol Grant Program. Go for it.
All right, thank you, Mr. Chair. So out of the gate, I should explain that this is a grant program the Sheriff's Office has previously participated in and is a participant in, so it's not necessarily new to the county, but looking to continue participating in this. The program itself allows counties that are eligible to essentially purchase a boat that qualifies for the boat patrol kind of approach that the DNR is looking for. And then with that upfront purchase, the DNR then reimburses the county over 5 years. And the reimbursement rate will fluctuate a little bit each year based on participation in the program, but also available funding at the state level. So you see like up to 75%, generally speaking, looking at the history of the program, you're going between 69 to 75% per year in terms of overall reimbursement. So at the end of the day, the county is still going to have some investment into it, but the 75% will get reimbursed by DNR. I've spoken with DNR about the program and about the boat that's listed in the resolution here, which we arrived at through getting 3 quotes per the procurement code. And that particular boat is eligible and would be approved under the grant if the county board were to approve this. We would also look to start this year so that if it were approved, we would purchase the boat this year, which would allow this year to be the first of the 5-year reimbursements. So we'd start that process right out of the gate. The resolution talks a little bit about the details as to why. If you look, the current boats are somewhat dated, a decade old, but they also have certain limitations, whereas the boat that we're looking to purchase here would give them more comprehensive sort of coverage in terms of the navigable waters within the county. So if you needed a shallower draft, or the jet outboard approach is going to get you into places where you couldn't get into with a typical outboard, then you're going to be able to respond more readily to those things if they were to occur, and not run into situations where they have in the past where when you get to a certain point, the boat can't get in. So now you have to wait for somebody with the boat to get to that location or find some other means to get there. Or, as the resolution also states, wait for the DNR to come with their boat, which is either the same as this one or with similar capacities, to get in there and respond in a timely fashion. So that adds some time to the response without that ability. So being able to purchase this expands those capabilities, and then at the end of the day, ends up being a boat that we pay for 25% of.
Because I'm curious, I have a couple questions. So how many boats do we have on Marathon County right now? Do we have just the one G3, or what do we have currently?
We have the G3 as a patrol boat. We have a John boat that augments dive operations. We have a pontoon that also augments that, and then we have an inflatable Zodiac.
So the John boat, does that have a jet, or is that a prop?
It's a prop.
So this is going to replace that. I mean, this is a glorified John boat, really. Let's be honest, with a jet. So to get into the marshy areas. So,
Correct.
I mean, okay.
And we've damaged the lower units
Yep.
on multiple boats trying to get into uprivers and things like that. So, and the John boat really that is not set up for a patrol operation.
Okay.
The one that is for dive.
All right. That was my question. So you're still going to have that other boat. So, all right.
We do plan to sell the John boat.
The John,
though.
okay.
Yes.
And I assume a lot of that $48,000 is equipping it to meet. Yeah. Okay. Supervisor Marash.
Our county board supervisors invited to go on a ride along with this boat.
Absolutely. You're going to have to jump. We'll put you guys ahead because Christy Palmer also requested the same. So if I could, just so you guys are wondering who I brought with me today, just so you know, I did bring the individuals who work in our recreational safety program. I've got Lieutenant Mike Van Offeren, Deputy Tyler Bremer, Deputy Brian Madreski, and then Captain Burkholder, who oversees all that as the patrol captain. So as this goes on, if you've got any questions particular to the program and the recreational, they also do snowmobile, boat, ATV, as well as they are partnered with Jamie Polly's crew from Parks and Rec and do a lot of different things there as well.
You'd much rather drive in the Deep V than the John boat, guys. I'm just saying. Any other questions? Go ahead.
And I'd like to make a motion to authorize the boat procurement with the ARPA funds pursuant to DNR Boat Enforcement Patrol Grant Program.
Motion made second. Any further discussion? All in favor? Aye. Any opposed? Motion carried. Thank you. All right, moving on. 6B, resolution regarding advancement of Regional Forensic Science Center project. And I will turn it over to Jessica and Craig.
Thank you, Mr. Chair. I'll start off with just a short reason for this resolution. And first of all, I'd like to thank the staff that's here, Chris and Sarah and Jessica and Lance. We've worked they've worked with the Morgue Task Force for several years. This task force has been in existence for 6.5 years. And we, with the hard work from the staff, I really believe this is why it's going to become reality, hopefully 2024. But you have the resolution in your packet, and the resolution is requesting the Public Safety Committee to authorize the Morgue Task Force to utilize $4,230,000 of the Social Improvement Fund balance. The additional $230,000 is needed to receive a $7 million matching fund from the Wisconsin Building Commission, which was part of the state budget. So the county will be able to get $7 million to utilize for the Forensic Science Center, but the county has to come up with the additional funding to get that $7 million. The current construction estimate for the Forensic Science Center is $14.8 million, which would mean we would need to come up, Marathon County would need to come up with $7.8 million. Besides the $7 million pledged from the state of Wisconsin, we are waiting to hear from the federal government. There was a congressionally directed spending grant that was authorized by Senator Baldwin's office for $2 million. I don't have to tell you what's going on with the federal government, but their budget, we may not hear anything from them in a while. But the WCA representative that's been working with this grant is optimistic that this grant will is still going to be authorized, or whether they get a long-term budget or not, because I guess where these congressionally directed spending grants is a little bit different than the entire budget. Representatives from the Morgue Task Force and the staff have continued to seek outside funding through grants, securing approximately $1,170,000 in additional funding as of December 1st. Now, Sarah may have some updates because she's the one that's handling these grants, and there are several of them still out there that we are hoping to receive some funds from. The applications are being considered, and like I said, we should get something from these other foundations. Staff are directed to engage the State of Wisconsin Building Commission to authorize disbursement of the $7 million for this budget. And again, at that point, we have to be able to provide the state with the other $7.8 million to build the Forensic Science Center. With approval of the resolution, staff will be directed to release requests for bids for construction in January and February 2024, not to exceed $14.8 million. This is another critical reason we need to have this available resources so that we can release requests for bids early in the year, because you do not want to wait March, April, June, then you're looking at probably waiting till 2025. So like I said, the authorization would allow staff to request bids for to build the Forensic Science Center. The Morgue Task Force and the staff will continue to raise funds to reimburse the social improvement funds as much as possible. I have no idea how much additional funds are going to be available, but we've received a lot of positive feedback from some of the foundations. Is there any questions from me? Otherwise, I'm going to turn it over to Jessica or Sarah or Lance or nobody. But and the request is, like I said, is to be able to use that 4.2 million to show the state that we do have sufficient funds to build this facility. This facility, we're getting a $15 million facility basically for, we're going to have 7.8 or 7.5 in this building. So,
Real quick. So I assume what we're doing today is we're going to make a motion, obviously, but then going to Human Resources and Finance yet? Are we sending it to them? Then it's going to the, the full board from there? We're not even taking it to executive? Or is it going to executive first, right to board?
the full board.
So this-
The process is public safety was first. Tomorrow's going to be HR Finance. And then Thursday,
Right to-
I'm hoping that both committees support this resolution. It would go to the whole board.
All right, I just wondered what process you were using, just, okay. Did somebody have any question for anyone over there, I guess? The line of people.
You know, from the staff perspective, I think the Task Force Chair McEwen's resolution that's before this committee, from the staff perspective, it really is kind of the last step. It's the project approval. I mean, that's what is before this committee and could ultimately be considered by the full board. It lays out each of the things that Chair McEwen referenced. It's the utilization of that social improvement fund balance, a portion of it to serve as the temporary match for allocating, or excuse me, for receiving the $7 million from the building commission, and it directs staff to start that process. I don't know how long that process is going to take, if that was going to be one of the questions people might have, but it directs us to start that as soon as the full board would provide that direction. It requires us, again, to move forward with the construction timeline that Chair McEwen referenced, to release those requests for bids in January or early February of this year to meet that construction timeline. And it provides direction on moving forward such that we would select the best qualified subcontractor bids. So Chris can talk more about process, but this is, we envision using, from the staff perspective, using a process which we've used before, which is the construction manager at risk approach. So it's selecting from the qualified subcontractor bids the total bid package, for lack of a better term. And then it also allows for the purchase of long lead time items, which Chris can talk about if there's questions on that. But succinctly put, we have some items that we need to, if you want to have, if the goal of the board is to have this project move forward expeditiously, there are things we need to purchase relatively quickly. Transfer switches, generators have very long lead times. I think the last was 80 weeks for transfer switches. And then the last part of the resolution calls for the remaining balance of the $2 million that has previously been authorized for this project to continue through June of 2024. But happy to answer any questions, but from the staff perspective, that's what Chair McEwen's resolution does, is it provides that direction to really move forward with the project.
Go ahead.
So I just have a concern that we're going to get to a certain point in this project after everything is all approved and we're doing this, that where it's going to be like North Central Healthcare all over again, where, well, now we're at a point and now we need more money and the roof is off and we can't not finish it because the roof is off and blah, blah, blah. So is there any way we can, once we get all the bids in and we pick our person, is there any bonding we can have them do so that it's capped and we are finished on time at our certain price?
The long answer to your question is that like Myron as construction manager at risk is bonded under AIA. In terms of the guaranteed maximum price, the number we've been dealing with has been very clearly articulated, even when we did the construction manager RFPs to get people on board with that. So anybody who would have come out of that process knows out of the gate that this is not exactly a hard bid, but for us, we've been treating it as such. It's kind of like a negotiated contract through school districts. You might have a referendum with a set amount. So that's been our driving principle in terms of overall cost. In terms of the number, the $14.8 million, we feel very confident about. And last week we had sort of, I won't call it a final budget meeting, but a all-together budget meeting, as previously during the design process, Samuel's group did a bunch of cost estimation, and then once Myron came onto the scene, they took all of their people and then not necessarily vetted it, but did the same work to kind of have two different approaches in terms of what are the true costs we're expecting to see. And so the number that came out last week was the 14.8, and that includes, obviously Myron has a lot of experience in terms of where costs are at. They're using 2024 figures, so there's a built-in increase in those already. We know that some things are going to cost more next year. And then it also includes reaching out to vendors, as you might do on smaller projects, to get a budget estimate, but across the board with known entities in the region to figure out what's this going to cost next year moving forward. And so it also includes an 8% contingency, which is just shy of $900,000. So that's a healthy contingency on a project like this. Plus, we've also been able to build the budget to a point where it includes everything that's been on the list to date. And so probably the pinnacle of that list would be the Lodox machine, which is $600,000. Does the facility absolutely have to have that to become operational? No. You can run with the X-ray machines, which will also be in there. That would be something you'd want to get down the road, but we've been able to manage all the other costs to fold that in. And the reason I bring it up is, like, if in some form or fashion what you're talking about will come to pass, you burn through $900,000 of contingency, even though you don't anticipate doing that based on the numbers, because we're within 60 days of the bidding window as it is now. And so it's not like there's going to be a lot of volatility between what we saw last week and what we'd expect to see once those bids go out. The other piece is that even though Myron is the construction manager at risk and they hold that risk in terms of running all the contracts, all of those bids come through the county. We have eyes on all of them for a variety of reasons. Sometimes certain vendors may not have the requisite expertise we want to see for something. But also, if something were to come back and say it came in over budget, all the bids were over. So there was, everybody's saying it's costing more than you thought it was 45 days ago. At that point, you could look at, okay, what are your alternative approaches? What are alternative materials? But if there wasn't a clear sense of that, what you would do is then take what you had bid out previously, you'd revise the scope, maybe to include some of those alternatives, and then reissue the bid to get back to the number you need to fall under. And so we've talked a lot about this, and we've had the conversations up to this point through shrinking some footprints here or finding some alternatives here. We've already identified things that we can pull out if we need to. So we have a plan should we, again, get into that situation. There are things we know, low-hanging fruit you can take right out of the gate off the budget and not do them, and it doesn't impact the facility or the operational aspect of it. They're nice to have, they'd be great to have, but it's not a fundamental need. So we've got that plan in place. We would do as I was just previously stating, and then then there's also some other things that we know we can take out because, for instance, there's probably $15,000 we could save, or we plan on saving, in terms of fencing. So a construction site needs temporary fence. We already have that. So that's not included. But when you need a hard fence, chain link fence around a facility, we already have fence around the Myron staging area at North Central Campus. So the intent is to salvage the fabric, if you will, the chain linking part of that fence and reutilize it, which would reduce what's currently in the budget, I think $43,000 all told, but you'd get 15 to 20 back. So that's not necessarily reflected in the 14.8 number yet, but that's also kind of the things that we hold in the back of our head going into it, and also gets back to why we feel so confident about that number. So ultimately, I won't say we were pleasantly surprised when we got through the Myron process, which is very rigorous, I should say, in terms of analyzing where we anticipate things coming in based on what I'm talking about. But I think we have we have a good plan. We have the things I was mentioning in terms of what we would do in that event. And everybody on board from day one already knows that 14.8 is the number we have to hit.
Thank you. And does this include signage and paving and landscaping? So we're not going to hear any more, right?
Correct. And there's even aspects of that where right now in the budget it's landscaping listed with a number. But when we get closer to that point, when we put a bid out, we would approach parks and say, what would it cost for you to do it? Things we've done that previously on the North Central Campus as well, to say, if you can come in at a different price, we'll have you do it rather than go out to market. And those are things that we can do as owner direct, which, if you're getting into doing a lot of things owner direct, some vendors might kind of get pushy with it. But the things we're talking about are small enough that it's not going to affect anybody, and everybody wants the project to be completed. So, in some of the conversations we've had, and I'll just give you an example. They say, well, if we get rid of this piece of the penthouse for the HVAC, that's only $8,000. And this is only $5,000. But my role in that conversation was, yeah, those are all nickels and dimes, but my count, we're up to 85 cents. So there's a lot of those things that will help along the way if we really need to adjust downward. And that's kind of the point I'm trying to drive home, is that everybody's hyper aware of the fact that we essentially have that hard cap ceiling. And so we won't be going above it. And we're at a point now where we can fit everything under that umbrella. And so whether it's Myron or the architects or the project team, everybody's very confident in where we're at.
Go ahead.
Thank you. I've watched this task force from the beginning and seen all of the changes that they have made in 6.5 years. I thought it was only 5. But I think that this has been hashed over and replanned so many times that I think y'all have it down to a science now, so to speak. But I think the services that we will be able to provide to the region and our area here will be, I think they'll pay for themselves. And the educational aspect, partnering with NTC, I think is going to be a real asset for the medical college, our law enforcement students, our nursing students, and any other educational aspect that will be tied to this forensic center. Tissue procurement, organ donation. Bodies don't stay fresh forever. And if we have that here, we're going to have a lot better service for people who need transplants, who need tissue. And I just think this is a wonderful, well thought out, well planned situation, and I am totally supportive. I've been supportive of this from day one. And I think that you've all done a fabulous job, and I really appreciate it. And with that, I would like to make a motion to approve the resolution. Do you want me to read the whole thing, David? Okay. I'll make a motion to approve the resolution.
A motion. Do we have a second? Motion made second. Supervisor Marash with the second. Any further discussion? I could talk on this for hours, but I'm going to just not talk on it at all. All right. All in favor? Aye. Any opposed? Motion carried. All right. Thank you. Moving on, 7, educational presentations and community discussion. Truancy Court program and process.
Want me to kick it off? There was a request, I guess I'll start and I'll turn it over to this group back here, but there was a request to have some opportunity to ask questions relative to the county's involvement in truancy court. And we have a number of people here. Krista Jensen from Social Services. Judge O'Neill has stuck around to answer questions. And we also have Sid from the District Attorney's Office. Who wants to start?
I'm Sid Brubaker with the DA's office. We have Angela Rogers here, who is the principal at John Muir. She's also the Dr. Hiltz designate for the Truancy Committee. So what I want to briefly do is talk about the Truancy Committee, the truancy court we have, how we got there and what we have. And then Angela's going to talk about, you'll find out when I talk that 75% of truancy court is kicked back onto the schools. She's going to tell you what that looks like. She's going to give you some idea of the challenges the schools have and how the county and the school can partnership. Okay? Now, first I'll talk about the Truancy Committee. It's a statutory committee. The statute says that each county or combination of counties should have a truancy committee. The members are listed. Obviously, the schools, the law enforcement agencies from the different schools, DA's office, clerk of courts, social services, school board, and anybody else that they think would be appropriate. And we've talked before that we thought that if the county wanted to be a part of it, somebody from the county board wanted to be on that truancy committee, that would be great, and we could make that work. Contact Angela Rogers, she can make that happen. So the truancy committee is supposed to meet once every 4 years. We meet once a year. Everybody's an equal member. There are two parties that have special duties. The district administrator is the chairperson, and that's Dr. Hiltz or his designate, and that's Angela Rogers. She's the chairperson. And the DA, Teresa Whetstone, has to be involved in every decision. So she's basically the attorney for the committee, and I'm her designate. So that's what you have with the truancy committee. It meets once every 4 years, and you have to have a written agreement once every 4 years. We had one from last year. Now, truancy court is over 20 years old. Before truancy court, what we had was JIPS. So if you're not a lawyer, if a juvenile commits a crime, that's a delinquency petition, and you go on there. JIPS is a sister. JIPS is Juvenile Needed Protective Services. That could be a juvenile uncontrollable child, or if a juvenile is charged with a crime and they're found to be not mentally competent to proceed, that's a JIPS. The last JIPS is truancy. So it could be JIPS for truancy. They would be referred up to DA's office. They would go up to the courts. There would be formal proceedings. And that's what we had before truancy court. Now, I think it was Judge Grau. At some point, he said, you know what, we can weigh having a truancy court or JIPS, which is better. And this is trauma-informed care before we even had such a thing. So you could either have over here with your JIPS, juvenile sitting with his public defender looking over at me with the social worker, or we can have truancy court, juvenile sitting with his parent looking over at me with the school principal. So we set up a truancy court about 20 years ago, and the way that worked is every school, if a kid had 5 or more days missed, they were habitually truant, they could be referred up to truancy court. And if they would be adjudicated truant, they would be put on a 1-year order, and then there could be sanctions, there could be services set like that. Now the problem with that is we have a lot of schools, and we had it on Thursdays, and then we had it on Wednesdays and Thursdays, and we were averaging 20 to 40 kids a day, which could take hours. Then COVID hit. We stopped truancy court. People reflected upon what we had, and we decided we needed a new model. Well, at the same time, Wausau West, right? Wausau West and DC Everest had a template, the ACC committees. And Angela's going to tell you about that. And those are committees that are partly school and mostly non-school members, like Judge Grau is Wausau West. So the kid, when he comes up and he's found to be truant, rather than refer him to truancy court, they're in that committee, and it might take 6 months from the start of that committee to truancy court if they're not working, and they have people come in, they have meetings, they have services and stuff like that. So when it worked for West and Everest, and we were looking at having a new model, all the schools, West, East, and the middle schools decided to have their own ACC committee. So that made it easier for us to go back to truancy court, and Judge O'Neill was part of those meetings. to come up with a new model where now instead of kids coming in for an initial appearance, review hearings, and then sanction hearings, they're only coming in for an initial appearance with the judge. Now we have 2 judges instead of 6 judges doing it. And the judge will enter the order, find to be habitually truant. The order, we put some services in place like mirror imaging or alcohol and drug assessment. And it goes back to the ACC committee to do all the review hearings. So the kids are only, because in the past, we could have 40 kids come in, 3 initial appearances and 2 sanctions, and all the rest reviews. So now the schools are doing the reviews, and instead of having 20 to 40 kids, we have 2 to 4 on Wednesdays and Thursdays. So that's where we're sitting right now. And I think at this point, it would be a good idea to let Angela tell you what those truancy committees look like, and some of the needs that arise because of, the situation we're in.
Thank you. I just want to really say, first and foremost, I really appreciate the DA's office support and social services. Just because I've met with other counties now that we've kind of been in year 2 of really following the new ACC guidelines and procedures, and really what it comes down to is truly the community support that we have here in Marathon County is next to none. And really working with these 2 agencies, I think, has been one of the biggest assets that we've had with why it works, the ACC committees. So what really happens is if a student becomes habitually truant and said, it's 5 unexcused days within a semester or 10 days in a school year is considered habitually truant. And we kind of go through a procedural expectation throughout Marathon County. So all of the school districts in Marathon County follow the same procedures now, have common language, common letters that are sent home to parents. And what happens is usually at that first or second step, counselors are meeting with students, social services within our schools, our social workers are meeting with students and families. And then when it gets to that level 3 is when we start to engage in more formalized meetings. We've also added in to try to get to the root cause of truancy within our schools. So prior to, we made a lot of assumptions of why students are truant to school, but this is a questionnaire that we have students and parents fill out to get to that root cause of truancy. If the student continues to be truant, we are lucky enough now to add mirror image services, so it's intensive supervision services, and that's an outside agency that works with families in school or out of school to try to get them to come to school. Prior to this new model, that could only happen during truancy court. So now we're trying to get the services to the families and to the students prior to even truancy court citations. The one downside to that is at school, for example, John Muir is only allotted 4 slots, and I have under 1,100 students in my school. So 4 slots is not ideal for that big of a school. And then the high schools in Marathon County only get 2 slots. So like a school like Wausau West that has a pretty big population, or DC Everest, only have 2 slots for the mirror image services, which we have found really works for students because it really meets them where they're at, engages with families, again, inside of school, outside of school. It's worked so much that we've, even within our school district, and I know Everest and Mosinee have also used mirror images services, and they've contracted with their services separate from even like the truancy court or social services. And then, so if a student continues to be habitually truant after that level 3, we move into that ACC meeting. In that ACC meeting, there's a different letter that goes home to parents that really, says how important a student needs to be at school. And then what we bring in is a community member. We bring in counselors. We bring in our social worker, school psych, administrators, our SROs in the building. And then we really have some tough conversations, but some good conversations about why the student is truant or is having issues coming to school. And then really it's trying to be proactive. Is it because of, a schedule change? Is it issues with friends? Is it what's going on to help the student? And I would say consistently, especially after COVID, it has been truly a lot of mental health related concerns. And that was why we really wanted to step away. Like, we shouldn't be bringing students to truancy court if it's truly a mental health issue, and how do we get those supports to students? So it's some of those conversations. Do we need to, have support from North Central Healthcare brought in, or our on-site counselors through the Marathon County Consortium? So there's a lot of different options we can do. The other thing that it does provide, it gets the families and students into the school, so we can start engaging in that relationship, which is extremely powerful, because sometimes that's the biggest hurdle, is getting the families and students into the building. And again, we would review these cases with students, and then usually about every 2 weeks or so, we'll review again to see how their attendance is going. I would say we last year did not bring any students from John Muir to truancy court, and this year maybe we'll bring a couple, but it's far less than what we had prior to like COVID, where we had probably 10 students at least that were attending truancy court. Yep. So thank you. So now that we're officially in that year 2, at least in Wausau, we are starting the ACC meetings as early as elementary school. So last year we piloted 2 elementary schools within the Wausau School District of, again, providing the services before we have to engage in possibly citing the family or parents for contributing to truancy. And then even if we would have to go through that, we would go through the deferred prosecution agreement with the DA's office. Again, not to punish, but to support the families and students getting to school. The Wausau School District also is trying to fund Mirror Image to help with these elementary students, because again, we think that the patterns really start as early as probably 4K or kindergarten, and that by the time they're already in middle or high school, a lot of these truancy patterns maybe have already been established. So really getting those supports and services at a younger age.
And then I think at this point, kind of let them know that we know the budget's set for this year, but going down the road, how can the county partnership with the schools to help with like mirror imaging and some other things?
Yeah, so I think what we've really gathered from a lot of the last 2 years is really, again, having those supports and services. We know that Mirror Image works. We know that we used to do, the Boys and Girls Club used to do a truancy abatement program where they'd come into the schools and they'd meet with the students. We know those programs work, and they work on that level of engaging students and also being an outside agency or community member sometimes helps build that relationship with the school if it's already starting off kind of negative. So they are sometimes our middle ground when we're trying to work with families, to know that we're all kind of on the same page, and we're here because we care about kids and we want them to be in school. So some of those pieces, like, it would just be really nice if we would have, again, some like those additional mirror image spots. And again, we're not the only community that is looking at this as like a need. Again, because our truancy court numbers are significantly down, but I would say our attendance truancy needs are extremely high yet. And again, it's based on like the mental health that we're seeing after COVID and different things like that, AODA issues, those types of things. So the need is certainly there. And I think, when we're meeting with our Marathon County Truancy team, and that's school districts from all over Marathon County, they are seeing the same things. The other piece to that too is, we have smaller communities within Marathon County, and they're not able to utilize some of the supports like Wausau maybe would be able to utilize because of just the proximity to where they're located. So for a mirror image person, maybe to go all the way out to Marathon can take a good part of the morning. So just having access for even the rural communities, I think, would be very helpful.
So you mentioned John Muir only has 4 allotted spots. I would guess that Horseman has the same.
Yes.
The high schools only have 2 slots. So is this a budget issue that is the reason that we have a reduced amount of slots? Because as I understand it, before COVID, we had a lot more mirror imaging services, and after COVID, it's been reduced.
So through truancy court, that's how students got those services. So they would go to truancy court. A part of that standard order is we would be requesting that student to get those services. Now it's just predetermined. So the hard part is, let's say John Muir sends, we have 4 kids and our spots are taken, but I have a 5th kid that goes to truancy court and I think they would benefit. There's not that spot available because I've already used my 4 spots. So we try to cycle through as much as possible. Like if it's not working for a couple weeks, then we take that student out so we can get another one in. So, I mean, it would be ideal to have more spots just because we know that that's an intervention that does work for students and families.
So how do we get more slots? Do we know that?
Well, I know that the school districts, for the elementary, we're contracting with Mirror Image, but I don't know, like we wouldn't have enough in our budget to say like, oh, and secondary could get additional spots paid for through the school district. Correct. Mm-hmm. Oh, sorry.
So I'm aware, like Mosinee went out for their own independent funding to increase this level of service. Social services has so many slots available, and then they've been divided out between the schools, as we've spoke about. And some of the reasons the high schools have been decreased is to try to put that to more preventative work within the middle schools, right? So maybe high schools had 4, and now this year they have 2 to try to give some of those to the middle school. So definitely is, let's say, a funding issue. And then really it's just a personnel issue. How many people do you have to go around to meet all of the truant youth? Even if it was Mirror Image, how many staff do they have to be able to provide that number? I think it's all of those components to be able to look at. It would be really interesting to see the data around the ISS services through Mirror Image and what those outcomes have been, right? So they've been involved with family A through Q. Does family A through R, they've gone back to school and the rest haven't, and what does that look like? I think that would be very interesting data to bring here and would be very important if this board is going to look at expanding any sort of budget to provide those types of services, to really see what your outcomes are going to be from that. But I mean, really, it's a great program. It's a huge support. There's not ever going to probably be enough to fully go around. But as much as we can collaborate and communicate, these ACCs have been a wonderful addition to our community. There was a lot of conversations about them for years prior to them being implemented. And we're really happy with the results overall. I can say at social services, we have seen a decrease in the number of youth coming to us who are on truancy GIPS orders, right? So where the ACCs don't work, where the truancy court doesn't work, we have 3 this year, which is a very low number. So they're working, absolutely.
Well, I know personally I would like to see that data that you mentioned. And then I guess the question for Lance would be, would funding through the Social Improvement Fund work for something like this?
I'll have to look at that. I don't have an answer for you today on what available funding streams exist. And I was just trying to pull up the document that we put together for the board in terms of orientation and the mandated versus discretionary service array as well. So I can look into both those issues and we can come back.
I guess just from my perspective, I feel like if we can work with these kids to help them earlier than having to work with them later, it just gets more expensive and the problems become more exacerbated. So I appreciate all your work and all the progress that you've made. Thank you.
So since COVID, mental health problems have been on the rise. Is that because the kids were more, is it a lot more to do with anxiety with coming back? Or, because during COVID, everybody was at home, kind of isolated. Does that seem to be some of the issues, or what tend to be more of the issues?
I mean, that could be a piece of that, certainly. Obviously, an increased awareness, too, of why students are considered truant. There's, we're seeing kids that are have truancy rates of, 50 days in school. So, I mean, there's a significant need. And I wouldn't say that, like, truancy court is necessarily the best option for some of those pieces where we really do need to get some of those supports and services into place for some of those students, because it could be anything from anxiety or whatnot. But that's why like things like Mirror Image are so great, because like they can go into the home, they can work with the family, work with the students, build those relationships. Sometimes it's even a level of like, I missed the bus, my parents are at work, I can't get here. So like Mirror Image can step in and just even bring the students to school or go out and check on the student. They're always at the table too if we're meeting with the student when it comes to the ACC meetings or prior to the ACC meetings of like, what can we do to help? Is it an incentive? Is it, I'll buy you lunch next week? You know, if you make it to school every day for a week. I mean, we really work with them to really find some engaging ways to get the student to school. Mm-hmm.
You know, I'm loud enough.
Okay.
I think what you got to consider, it's not being said, is a lot of these kids, they live downtown, and we know that 50% of the families downtown live in poverty. 70% of the single moms live in below poverty. That they don't trust the school, they don't trust law enforcement, so you can't send the SRO out. If the school goes out, they don't trust them. Mirror Imaging has no affiliation with the school officially or law enforcement. They come in and they accept these people as an outsider, and they will talk to them, whereas they won't talk to the school, they won't talk to the SRO. So that's where they're so effective, is they view Tom Marquardt and Mirror Imaging as something beyond, something different than the school, and they will let them in the house, they will let them do stuff with their kids that they won't let the school do.
So another question with the Mirror Imaging, I know with CART, when we talked about trying to expand CART because it's working as well, but there aren't enough counselors available to go along with law enforcement. You're talking about Mirror Imaging, and so we have enough resources, they have enough people on staff that if it were to be expanded, that would be feasible or not?
I don't want to speak for Mirror Image, not being an employee of them and fully understanding their personnel, but I would say no. The number of students that are truant with the number of slots that could be potentially used by the school, if we had unlimited resources, there likely would not be enough personnel to go around, right, to make those stops that Angela was speaking of, to pick the children up for school or encourage them to get there. There's just more students who are truant and have struggles than there are people to go around to bring them as needed.
So I guess we're just going in a circle. Is that what I'm hearing? Because I'm just like trying to think of ways that we could help, and then I'm hearing that even if we could find a way to help, then it's not going to work anyway because there's not enough people to do it. Am I just curious?
People are looking at me. I'm a perpetual optimist, so I'll say this. I think I can bring back the information. I think my inclination on the social improvement fund dollars is that certainly the unrestricted dollars could be utilized for that purpose. I think the opportunity always exists for what was referenced before, and that is partnership and determining who we can bring to the table, because many hands make light work, right? As opposed to, hey, this is all one entities, whether it's the school or social services or the courts. It's not any one entity's responsibility. But to your point, we're all better served when we kind of invest in those preventative services. We've seen that with social services and our community response program that we have. That's worked very well. So I hesitate to say that there's not a way to do what you're alluding to, and partnerships work very well. In one of our previous presentations today, we talked about the role of nonprofits, which I think is also there's an opportunity for local government to do that better. So I hesitate to say that there's not a way that we can find more people to bring to the table to do the work, but it's going to be exactly what was alluded to. How do we bring those people to the table and bring the resources that are necessary as well? Because at the end of the day, there is going to need to be funding allocated for it.
And I think we just have to be, creative with that too, because I think there was, like I said, I even mentioned not just intensive supervision or Mirror Image, but even things like the Marathon County Truancy Abatement Program that the Boys and Girls Club facilitated with us prior to COVID. And then, things like the report center that we don't currently have anymore. And that was an opportunity for students to either go after school or on the weekends to kind of make up some of those hours or get some support on some of those academic pieces. So I think there are options more so than even just a mirror image, but I think if we can work together, it certainly has been my feeling overall has been that we come together to make what's best for students.
All right, anything further? Thank you very much for the presentation. All right, with that, we'll move on to 8, next meeting date and time announcements and future agenda items. As always, committee members are asked to bring ideas for future discussion. 8B, next meetings, Tuesday, January 9th, 2024. We will have the dual meeting, so just make note of that. We'll do it immediately following our regular meeting. With that, I'll take number 9. Motion made by Supervisor Marash. Do I have a second? Supervisor Wilhelm, all in favor? Aye. Any opposed? Motion carried. Thank you, everyone.